Antimicrobial resistance occurs when microorganisms such as bacteria, viruses, fungi, and parasites change its ways that render the medications used to cure the infections they cause ineffective. This is a major concern because a resistant infection may kill, can spread to others, and imposes huge cost of individuals and society. Research has demonstrated a correlation between antibiotic use and resistance development. However, resistance to antibiotics is increasing globally and is a threat to public health. About 10 million people will be dying from infection by 2050, according to scientists and researchers. This, they say, is as a result of the rate at which microbial resistance is growing, whilst companies working on new antibiotics for treating infections are fading away.
If we don't take action now, so if we don't take action now, we'll get into that situation. In fact, there is projection that in 2050, if we don't handle the current near crisis situation, you would have about 10 million people dying out of infections caused by resistant microorganisms.
Developing countries are the most affected by resistance because of high infectious disease burden, limited access to quality assures antibiotics and more optimal drugs, and poor antibiotic use practices. However, experts say the appropriate use of antibiotics to slow the pace of resistance development is crucial. Ghanaians are being cautioned to know where to buy the drugs and how to use them.
We'll be able to tell the resistance pattern, the drugs which are antibiotics which are no longer effective. Talking about surveillance and resistance also, it should be a collective effort if we really want to tackle AMR. So human beings, our irrational use of antibiotics drives the resistance pattern. Those working in the animal sector, they also want to use antibiotics in various infection control as drug promoters, etc. And if we are irrationally using the antibiotics, then we'll be fueling the resistance level. So it should be a collective effort. If you go to the hospital, for example, you are given some antibiotics, you start using it 1, 2, 3 days, you feel better, then you stop taking the full course. You are somehow inducing resistance in the system. So it should be a collective effort.
According to Dr. Japheth A. Opintan, the country is currently not having any solid data on its research studies and works on the health sector except pockets of individual researchers, and a situation which doesn't augur well for the country.
So like I mentioned earlier, you can find pockets of research that has been done. There is a little bit of challenge in the sense that data management in the hospitals, in the facilities is a little bit difficult. But if you want data, it will be individual research work which people have done. I've had the opportunity to done some work looking at the baseline data of the country in terms of antimicrobial resistance. So and a few other people have also generated some data. But if you want continuous active data, we must then put some efforts into it so that we equip the facilities, the hospitals, to generate the data, and the data can then be collated. Then we can get the national data.
Ghana as a country therefore needs a surveillance culture attached to the various health institutions in a country to help aid health practitioners deliver holistic healthcare delivery to its citizenry.